Staphylococcus aureus is a type of bacteria commonly found on the skin or in the nasal passages of many people without causing harm. However, under certain conditions, it can cause a range of health problems in humans. These bacteria can lead to infections when they enter the body through cuts, wounds, or other breaches in the skin. One of the most common issues caused by S. aureus is skin infections, such as boils, abscesses, or cellulitis. In more severe cases, the bacteria can spread to deeper tissues or the bloodstream, leading to conditions like septicemia, which is blood poisoning, endocarditis, infection of the heart lining, and osteomyelitis, bone infection. Staphylococcus aureus can also produce toxins that lead to more serious conditions. For instance, the bacteria can cause food poisoning when the toxins contaminate food. These toxins can also lead to toxic shock syndrome, which is a life-threatening condition marked by fever, low blood pressure, and even organ failure. Some strains of the S. aureus, particularly methicillin-resistant Staphylococcus aureus, are resistant to commonly used antibiotics, making infections harder to treat and leading to more complicated health problems. If left untreated, these infections can cause significant complications and even be fatal. Overall, while S. aureus is a normal part of the body's microbial flora, when it becomes pathogenic, it can result in a wide array of infections, ranging from mild to life-threatening. Staphylococcus aureus in food poses significant public health risks, as it is capable of producing toxins that can lead to foodborne illnesses, especially if proper food handling and storage practices are not observed. So factors contributing to the prevalence of Staphylococcus aureus in food include the fact that it is a versatile pathogen, so it thrives in a wide range of environmental conditions. The bacterium can be found in a variety of food items, particularly those that are handled or prepared improperly. There are several factors that contribute to the prevalence of this in food, which include contamination during food handling, storage, and processing. So number one is human contamination. Staphylococcus aureus is a natural inhabitant of the human body, particularly the skin and nasal passages. Therefore, foodborne contamination often occurs when food handlers with poor hygiene practices touch food without washing their hands, or even when food comes into contact with contaminated surfaces. The second reason is improper storage and temperature control. Staphylococcus aureus thrives in foods that are not stored at the correct temperature. The bacterium grows rapidly at temperatures between 20 degrees Celsius to 37 degrees Celsius, and its growth can be enhanced when foods are left at room temperature for extended periods. Foods such as salads, deli meats, and dairy products, which are often served cold but may not be refrigerated consistently, are common vehicles for Staphylococcus aureus contamination. Number three would be a wide range of food types. So Staphylococcus aureus can survive in both cooked and in raw foods. It is commonly found in meats, dairy products, eggs, and baked goods. The bacterium's ability to produce heat-stable enterotoxins further complicates its role in foodborne illnesses. Even when foods contaminated with this are cooked, the toxins produced by the bacteria can remain active and cause illness. So number four would be cross-contamination. So cross-contamination occurs when Staphylococcus aureus goes from one food item and is transferred to another, often through shared kitchen utensils, cutting boards, or food preparation surfaces. This is especially a concern in busy commercial kitchens, where food items are handled and prepared in close proximity to another. So the symptoms of Staphylococcus aureus contamination in food are primarily caused by the ingestion of the enterotoxins produced by the bacteria. These toxins are heat stable, meaning that they can survive if the food is cooked or reheated. The symptoms of food poisoning due to Staphylococcus aureus typically appear rapidly, often within 1 to 6 hours after consuming contaminated food. The main symptoms include nausea, which is one of the first signs of food poisoning caused by Staphylococcus aureus, which typically occurs shortly after consuming contaminated food. Number two would be vomiting. This is another common symptom and often follows nausea. Vomiting can be quite severe and can lead to dehydration if fluids are not replaced. Number three would be abdominal cramps. So abdominal pain and cramping are common, typically occurring alongside nausea and vomiting. The cramps are often intense and sudden. Number 4 would be diarrhea. Many individuals experience diarrhea, which may range from mild to severe. It can sometimes be accompanied by loose or watery stools, or if you eat Taco Bell. Number 5 is sweating. Some people may experience sweating and general malaise, which is often associated with the body's response to the toxin. Number 6 is a headache. Headaches are sometimes reported along with other gastrointestinal symptoms. In regards to treatment of Staphylococcus aureus, since it is known to cause food poisoning when it produces toxins in contaminated food, this type of infection typically doesn't require antibiotics because the illness is caused by the toxins, not the bacteria itself. So treatment primarily focuses on relieving symptoms and preventing dehydration. So it is important to rehydrate, so that's the most important aspect of treatment for food poisoning caused by this. Oral rehydration solutions or electrolyte drinks can help replace lost fluids and salts due to vomiting and diarrhea. Resting helps the body recover from the stress of illness as well. Antiemetics, in some cases, medications to reduce nausea and vomiting may be prescribed to help alleviate symptoms, though they are not always necessary. So number 2, for skin infections, whether that be boils, impetigo, or abscesses, usually topical antibiotics for mild skin infections, over-the-counter topical antibiotics can be used to treat the infections. Oral antibiotics in cases of much more extensive skin infections. Oral antibiotics such as diquoxacillin, sulfaxylexin, or I can't remember how it's pronounced, may be prescribed. So the key points of Staphylococcus aureus in food safety regulations include prevention of contamination. Effective hygiene practices in food handling, preparation, and storage are imperative. So control of temperature, which means maintaining appropriate temperatures to prevent the bacterial growth. Monitoring for toxin production. Implementing systems like HACCP to control conditions that encourage toxin production by S. aureus. Reporting and recall. So protocols for handling outbreaks and recalling contaminated products. Education and transparency. So providing proper food handling guidelines to consumers and food industry professionals is also important. Staphylococcus aureus is a gram-positive bacterium which is commonly found in human skin and nasal passages. It is one of the most notorious foodborne pathogens worldwide. This microorganism is responsible for a variety of illnesses, ranging from mild food poisoning to severe life-threatening infections. The prevalence of Staphylococcus aureus in food poses significant public health risks, as it is capable of producing toxins that can lead to foodborne illnesses, especially if proper food handling and storage practices are not observed. So factors contributing to the prevalence of Staphylococcus aureus in food include the fact that it is a versatile pathogen, so it thrives in a wide range of environmental conditions. The bacterium can be found in a variety of food items, particularly those that are pre-handled or prepared improperly. These are several factors that contribute to the prevalence of Staphylococcus aureus in food, including contamination during food handling, storage, and processing. So number 1 would be human contamination. Staphylococcus aureus is a natural inhabitant of the human body, particularly the skin and nasal passages. Therefore, foodborne contamination often occurs when food handlers with poor hygiene practices touch food without washing their hands, or when food comes into contact with contaminated surfaces. This is particularly problematic.
Staphylococcus aureus is everywhere, as it's a ubiquitous bacteria. Most people have it on their skin or in their soft tissues, although it particularly enjoys being in your nose. In fact, approximately 30% of people carry it in their nose, and it's normally innocuous, but it can become deadly. In a healthcare setting, it thrives. So like in a hospital or a care home, it is known to infect and cause septicemia of wounds. It's also a foodborne disease. In fact, it's one of the most common foodborne disease worldwide. It is not the bacteria itself that causes the foodborne illness, but it's enterotoxins. Staphylococcus aureus can be found pretty much anywhere. It's all over our skin and in our nasal passages, and on many surfaces we touch. In order to identify Staphylococcus aureus, typically multiple tests are done, or a combination of tests are done. These include gram staining, as S. aureus is a gram-positive cocci, a catalase test, as S. aureus is a catalase-positive bacterium,